Hi everyone, welcome to our video teaching on patient transfers. My name is Margaret.
And my name is
I'm
Max.
Christine.
And I'm Bridgette.
What is patient transfers? Patient transfers involve moving patient from one surface to another. This could include moving a patient from bed to stretcher, from bed to wheelchair, from bed to chair, from wheelchair to toilet, and vice versa.
The CLPNA competencies patient transfer addresses are safety. A licensed practical nurse will demonstrate knowledge and ability to utilize controls to identify and reduce risk of physical injury of self and others, including safe lifting and transferring of loads. Nursing practice. A licensed practical nurse will demonstrate knowledge and ability to assess client functional status, to independently perform self-care, including functional mobility, lift and transfer. Orthopedics. A licensed practical nurse will demonstrate knowledge and ability to assess and manage ambulation and immobilization needs, including using canes, crutches, walkers, wheelchairs, and mechanical lift. Peri-operative specialty. A licensed practical nurse will demonstrate knowledge and ability to perform duties and responsibilities, including assisting the transfer of client from operating room table to stretcher. Here are the guidelines to follow during patient transfer. 1. Raise the side rails on the side of the bed opposite you to prevent the patient from falling out of bed. 2. Elevate the level of the bed to a comfortable walking height. 3. Assess the patient's mobility and strength to determine what assistance the patient can offer during transfer. 4. Determine the need for assistance from other care providers or mechanical lift. 5. Explain the procedure to the patient and explain what is expected of the patient. 6. Assess for correct body alignment and pressure areas after each transfer. 7. Evaluate your own strength and limits to reduce the risk of injury to yourself and patient. The following are equipment used for patient transfers: wheelchair, transfer belt, sliding board, draw sheet, sling, lift, pillows, and non-skid shoes.
Okay, I'll be demoing transfer from bed to wheelchair. Okay, and for this demo, I have the equipment that I need right here. My patient left-sided weakness. So I have my transfer belt, I have my mark, okay, and I also have making sure that these work. So, okay, the wheelchair seat belt works, and also making sure that my transfer belt works. The brakes on my wheelchair, double check, okay, they work. All right, so now I'm just gonna go in to see my patient. Where I go, I'm just gonna clean my hands. Okay. Hi, Susie. How are you doing? I'm Christine. I'll be your student practical nurse for today. I'll be taking you to physio. How are you feeling?
I'm good.
Any dizziness, any lightheadedness?
No.
Okay, I'm just gonna verify you. So I have my Mar here. I have Susie Adams. Okay, Susie Adams. Date of birth 1942, November 14th. 1942, November 14th. Okay. Okay, could you state your date of birth for me, please?
November 14th, 1942.
Okay, good. So yes, I'm gonna be transferring you to physio, and I'm just gonna make sure that your bed is safe and locked. Okay, and it is indeed locked. It is locked. Okay, and while we had it, I'm just gonna provide you with some privacy. Okay. All right. So I'm just gonna raise the head of your bed a little bit so it's easier for you to move. Okay. comfortable
Yes,
for
that's
you?
okay.
Okay, I'm just gonna lower your legs. All right. I'm gonna put the table a little bit back. I'm just gonna get you to cross your legs for me, please. There we go. All right, and just maybe a little bit higher. What is it? Okay. I'm just gonna help you up, and I'll get you. There you go. All right. And if it's okay with you, I'm just gonna put this transfer belt around you. Okay, I'm just gonna make sure that it's a little bit, okay, a little bit more, and okay, 2-finger fit. Okay, it is good. I'm gonna get your shoes ready. Okay, clean my hands again because I touched your shoes. Position the wheelchair right there. There we go. And at any time, let me know if you start to feel dizzy or any headache, okay? Okay. Okay, on the count of 3, I'm gonna help you to stand. So you could just stand slowly. Okay? On the count of 3, 1, 2, 3. Okay. And I'll just get you to turn. Okay. And step back. Can you feel the wheelchair at the back of your knee? Okay, step back a little bit more. How is that? Okay? Alright, I'll get you to sit very slowly. Okay. There we go. And I'll just remove your transfer belt. Okay, so I'll double check, make sure it's 2-finger space between. Okay, you're good. And I'll just get you to kind of lift your feet up. Okay. There you go. Just going to release the brakes. And sometimes. And half the physio we go.
Transferring patient from bed to stretcher. Hand hygiene, introduce yourself and explain the procedure to patient and reason of procedure. Verify the patient. One nurse assume the leader role. Use a friction reducing device under the patient like a draw sheet. Nurses need to be on the opposite side of the bed holding the draw sheet. The stretcher and the bed are placed side by side so that the patient can be transferred quickly and easily. Transfer board should be placed under the patient to maintain spinal alignment before transferring the patient. The patient should be prepared for transfer and asked to help when possible by folding the arms over their chest. Lower the head of the bed so the patient is flat and cover the patient with a sheet or blanket for privacy and warmth. Assess patient level of consciousness, ability to understand and follow directions, and ability to assist with the transfer. Close her door or draw the curtains for privacy and perform hand hygiene. Raise the level of bed so it's slightly higher than the stretcher. Make sure the brakes are locked on both bed and the stretcher. Remove the pillow from the bed and place it on the stretcher. Ask the patient to roll away from the stretcher. Then place the sliding board over the gap between the bed and the stretcher. Help patient return to a supine position on the sliding board and ask her to cross her arms on her chest. Each nurse should assume a board base of support with one foot in front of their other, and knees and hips are flexed, keeping her body aligned and her back straight on the count of 3. And the 2 nurses on the stretcher side of the bed should gently pull the sliding board toward to themselves. Roll the patient to her side and remove the sliding board. Center patient on the stretcher with patient body in alignment. Make sure patient is comfortable and raise the rails on the stretcher. Keep patient safe and protect yourself from injury.
Hydraulic or motorized lifts. Transferring a patient from bed to chair using a mechanical lift. First of all, you need to ensure that you are thoroughly familiar with the operation of the lift. This lift usually requires 2 nurses for a safe transfer to be performed. First, an appropriate size of sling should be chosen for the patient's weight and height, and the lift positioned properly at the bedside. Position the chair near the bed and allow adequate space to maneuver the lift. This ensures a safe environment for safe use of the lift. You can then raise the bed to an appropriate working height with mattress flap and lower side rails. This maintains the nurse's alignment during the transfer. Keep bed side rails up on the side opposite you to maintain patient safety. Roll patient on side away from you to position patient on hydraulic sling. In positioning the sling, place lower edge on the patient's knees, upper edge on the patient's shoulders. This places the sling on the patient's center of gravity and greatest portion of body weight. Roll patient on opposite side and pull sling through. Remove patient's glasses if there are any. Attach hooks on strap to holes in sling. The short straps hook to the top holes of the sling, and the longer straps hook to bottom of sling and are crossed over one another. Elevate the head of the bed and get patient to fold arms over chest. This positions the patient in sitting position. The lift is then used to raise the patient off the bed and maneuver to the chair. The patient is positioned and lowered slowly into the chair. Once the patient is well positioned, remove straps and mechanical lift. Check patient's sitting alignment and correct if necessary. Perform hand hygiene and make sure you're always evaluating patient's tolerance and level of fatigue and comfort.